Hello, it's 11 a.m. here in South Korea. I'm Woo Young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak here in the nation. In just a few moments, we'll cut into the briefing room at Sejong Government Complex with simultaneous interpretation available for you in English. Health Ministry official Yoon Tae-oh will be giving us the details on the COVID-19 situation as of Wednesday midnight. He will be filling us in on the number of new infection cases as of today, as well as the efforts that the government is making to contain the virus, especially after the Lunar New Year holiday season, where many people were traveling and gathering in clusters. The health official has now entered the room and is standing at the podium. Let's take a listen to what he has to say.
Let us now begin our regular briefing for February 17th, Wednesday. As of today midnight, we have 519 new local infections and 31 new imported cases. Yesterday, we had 4 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. After the Lunar New Year holiday, we are seeing a continued rise in our daily tally, and this rate of increase also could be a temporary rise due to the increase in the number of tests conducted, and we need to also discuss and monitor whether this is also another resurgence of the virus within the third virus wave infection here in South Korea. And in a daily basis average, we also have about 342 local infections, which is about 70 in the metropolitan area, which is about 75% of the total cases. And we are seeing a resurgence in the metropolitan area, and we have also higher risks in the capital area. So we ask for your continued vigilance going forward. And here are some details of our quarantine response measures. Yesterday, a total of 80,000 tests were conducted, and at the test centers, we carried out about 47,000 tests. And also some 40,000 tests were conducted at the temporary test centers nationwide. So in order to prevent the virus spread to your loved ones and your acquaintances, please visit these screening centers at the earliest possible in order to test yourself going forward. And we also have very much medical capacity, which is sufficient right now. And we have about 509 hospital beds available for the critically ill patients, and we also have about 12,000 tests for these patients with light or moderate symptoms, and there are 0 patients who are waiting to be administered to the hospitals. And also up until now, public doctors, public medical staff members, they have also stood at the forefront of fighting the COVID-19. However, with the prolonged COVID-19 battle, they are experiencing a high level of fatigue. Moreover, with the vaccination rollout here in South Korea, we believe that there could be more higher demand of these public doctors going forward. To this end, these newly nurtured doctors, public doctors, they will also starting from now, they will be exempted from the medical training, and they will also be dispatched to the scene. And about 270 people of them will be dispatched, while 300 additional public doctors will also be dispatched going forward. And going forward, we will also note that we are exerting our all-out efforts to support our domestic doctors here in South Korea. And we have seen about 60 million people hitting the road during the holiday, during the weekend, and which is quite a rise from the previous week. And we have seen that this is about 30% hike from the previous week as well. And we believe that in the metropolitan area, we have seen a downgrade of the mobile traffic and foot traffic by about 6.9%. However, we we have seen a weekly surge in the non-metropolitan area. Lately, we are seeing a continued rise in the number of daily tallies, and if we have more people hitting the road and more people moving around, we believe that we could also have a resurgence of the virus. So we would like to make sure and ask the members of the public to also continue to exert a sense of vigilance and also minimize your movement and foot movement, and we ask for your participation going forward as well. Moreover, we are seeing more cluster infections stemming from our day-to-day venues, including hospitals, restaurants, workplaces, as well as family gatherings. And we believe that after the incubation period, the virus could even spread further after the end of the Lunar New Year holiday. And upcoming spring, we also have the vaccination rollout plan here in South Korea. And in order to make sure our students have a safe start of the new school year, we need to also curb and put a stop on this third wave of infections. So we ask for your continued participation in the quarantine measures wherever you are. And these antivirus measures could also be very effective in protecting yourself from the COVID-19. Lately, we have seen many indoor sports gyms which have been subject to cluster infections. And we believe that at these venues that have been subject to these social distancing measures, these venues indeed could be also further subject to another cluster infection. So we ask you to refrain from going to crowded, confined, and close contact environments, and please carry out and practice healthy distance with others as well. Moreover, we ask for the managers and staff members at the multi-use facilities. We believe that the COVID-19 virus infections risks cannot be evaded right now, and we believe that if your spaces are crowded with people, thus you could also have higher risks of infection. We need to also minimize these risks of infections going forward, especially at multi-use facilities. In order to minimize these risks of infection, we ask you to comply with these epidemic control measures. Moreover, if you have these facilities where the objects and the surfaces are frequently touched by many people, we ask you to ventilate and disinfect your area on a regular basis. And we are seeing also many cluster infections stemming from university hospitals, and we believe that going forward, we will be carrying out the regular mass testings of these people at the nursing hospitals twice every week. And we believe that this will be carried out going forward. And if we also see further risks, we could also adjust these as well. And starting from today, we will be supplying to the medical institutions the Rekinora, which is the antibody treatment developed with homegrown technology here in South Korea. And we believe that they will be administered to the patients if they are going through severe symptoms of COVID-19, including symptoms of pneumonia and so forth. And as for the details of the application means, we ask you to also to have the guidelines from the local governments and authorities. And starting from the end of this year, we will begin our inoculation plan. And we also believe that if we are added with our vaccination together with our drugs and therapeutics on top of our epidemic control measures, we believe that we can return to a state of normalcy very soon. We will also exert our full efforts. Thank you very much.
네, 지금부터 질의응답 시간을 가지겠습니다.
That was a government briefing you just heard on the COVID-19 situation here in South Korea. The country reported 621 new cases of COVID-19 as of Wednesday midnight. This brings the accumulated number of COVID cases to 84,946. Unfortunately, there have been 4 more deaths, raising the total death toll to 1,538. We're going to have to wrap up the coverage here, but we will be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.